for joining us. We are happy to be offering these fireside chats with Dr. Audrey Baker and myself. We hope to do a series of them. We're going to kind of see how this first one goes, and then we'll go from there and schedule some other ones. I want to start with just a little bit of an update of what is happening around school and give you a peek onto our campus, because unlike a normal year, we don't get to have you here. And we want to share some of the great things that are happening on campus. A lot of people have been asking, well, what's going to happen? Are you guys going to close after Thanksgiving? What's going on with the level of spread? And bottom line is we are listening to our local health officials. So the Pima County Health Department has still indicated that it is safe for schools to remain open in this hybrid model. So unless they tell us otherwise, that's our plan. So we'll talk more about the specifics of what's going on in the community and around the country and the world with Dr. Baker. But let me give you a little peek as to what's happening here at Manzanita. Can you guys see this all right? Are you seeing that? Yes, okay, I see a nod. Thank you. Learning is happening everywhere at Manzanita, and so we are taking advantage of our entire campus on the days of in-person learning. So you can see multi-age math happening outside on the patio as well as in the multi-purpose room. These are just some examples of what's happening. Fifth graders, this was just this morning, they're working on their social studies. They're outside, they've got these little yoga mats, and they just travel around. Here they are, a few of them, and they're all spread out and comfortable. I mean, what a beautiful setting to learn in. We do have our indoor classrooms that are set up with ample spacing. So here you see an example of a kindergarten room. You see an example of a fifth grade classroom with the walls open. And so we've ensured that we have our 6 feet of distance in our indoor classroom spaces, and then make use of the outdoor spaces whenever possible. Oops. Whenever we're going places, we are constantly watching our distance. So we're reiterating the 3 W's, the wash your hands, wear a mask, and watch your distance. So here's a couple of examples of kids moving around the campus. Kindergartners coming back to class from the playground. We're teaching them to use these kind of airplane arms as they're walking, or zombie arms, sometimes they're called. And then even third graders, as they're returning from their outdoor learning space, which is on the Ramada by the playground. They've just been doing a reading lesson out there, and they were on their way back to class. And so here they've just stopped to kind of reorient and make sure that they were watching their distance. Lunchtime for our in-person learners is happening outdoors and physically distanced. So we've got designated spots where kids can sit, but they are all out of doors. And the playground is still happening as well, and kids are wearing their masks on the playground. We have these little spots along the fence where kids can line up. So when it's time to leave the playground, they go to a colored spot along the fence, so that they are starting physically distanced, and we're continuing to train and reinforce what that needs to look like during the school day. So that's just a very short snapshot, but I thought it would give you a visual of what things are looking like here on campus. So I am going to stop sharing my screen and have Dr. Baker share hers instead. Did I stop? Audrey, are you able to get on?
I think so.
Okay,
yes.
good.
Yes. Well, thank you for having me. It's just so much fun to see those pictures and to see all of the students happy and learning, and they're outside and they're physically distanced but socially close. So I really love seeing that. I am going to try to share my screen here. Hopefully you guys can see it.
Yep.
So What I wanted to talk about today is, first of all, how amazing the international scientific community has been. And if you are a scientist or really anybody in the world right now, you have completely pivoted and put all of your attention on this virus, for better or for worse. And what it has done is it had created some amazing scientific opportunities across the world. And what I wanted to do today is really focus on the question of transmission in children and transmission within the school setting. And there's lots of data from across the world that I'd like to present today. Really, when scientists are looking at this question, they want to know, is it safe to keep schools open in the setting of broad community transmission of COVID? Is it safe for students? Is it safe for the community at whole? Is it safe for everybody that's surrounding the students in the classroom and the staff? Are the schools actually acting as amplifiers, independent of community transmission? And finally, what I'd like to talk about today are some of the theories why it doesn't seem like young children transmit the virus as effectively as older children and adults. One of the wonderful institutions globally is Insights for Education, and I encourage you to visit their website. What they are is they're a global nonprofit community who offers global consulting for many different educational matrices across the world. And over the past 7 months, they've been collecting really exquisite data from over 191 countries on both community transmission, transmission within the school, transmission among students and to staff. And they've compiled this map here. And what you can see, hopefully you can see my pointer, is they've color-coded it, which countries are open for school and which countries are closed. So all of the countries you see in green are open for in-person learning. The countries in yellow, including the United States, are partially open. That means either some are open and some are closed, or some are in a hybrid fashion, as Manzanita is. And you'll notice that many of the countries in the world are still in red. So many of the countries you'll notice that are closed to in-person learning are countries that have not yet come out of their first wave of the disease. And what I'd like to talk about today is what they found, looking at all of the data in their most recent interim analysis. They didn't find any trends. They can't say with any certainty if opening schools is a problem for communities or is not for communities. And when I say a problem, I'm really specifically talking about viral transmission rates. The data has a lot of heterogeneity. There are some countries that are looking at community transmission. There are some countries that are looking at transmission within the schools. So it's very difficult to compile those different data points to come up with any coherent answer. But what we can do is really dial in on some of the data sets from countries that are open. So the first thing I'd like to do is look at some of the first data sets from both France and Spain. France was the first country to come out with some data on community transmission within schools. Now, what this is just a snapshot. So on April 30th, scientists looked at 6 schools just north of Paris. They chose this community because they had a very high transmission rate. And what they found was that when they tested antibodies for students and staff working in those schools, they found no evidence of transmission from primary school forward. What that means is that although they did find individual cases of COVID within the school, they found no evidence that this was transmitted through the school. There were siblings that had COVID in the same school, but they assumed that they caught that at home. And they didn't see any evidence of outbreaks within the school. So this is interesting. This was really the first piece of information out there that opening schools may be safe. You remember, I know it seems like forever ago, but last spring, I mean, everybody shut down everything because we just really didn't understand what we were dealing with. We didn't know if this was a virus more like influenza, where children are just a petri dish for community spread of the flu. It doesn't seem like the coronavirus is the same, although again, the data is not clear yet. I also wanted to review some data from Spain. Now, what they did is they did not look at individual schools. They looked at the community as a whole. So they looked for 3 weeks after schools were open in the beginning of September, and they looked at 4 different regions. And within those regions, you can see here, the arrows are noted what date. Now, this is actually date, month, year, because we're in Europe here. So this is September 7th and September 10th and September 14th. And this is in each different region. So you can see that out of these 4 regions, these 5 regions, only in Lyon did they see some exponential growth after school was open. And actually in this region, there were a few other outbreaks that they're attributing that to. So the data is unclear. But over almost all of Spain, when you average all of the data, and in each specific region, what you're seeing is a reflection of what is going on in the greater community, and not necessarily an amplifier once schools were open. You don't see an exponential increase after the date of school opening. When they looked at all cases, nearly 87% were all single cases found within schools, meaning that only the minority was an outbreak within the schools. And this is, of course, looking at thousands of different schools. So going back to our map, the one other area I wanted to drill down on internationally, which a lot of the great data has come out of, was in South Korea. Now, they have a really extensive contact tracing program. So their data focuses on the contacts themselves. So you can see here that they looked at their data via the age of the different students. And what they found is that in very young students, you can see over here, it's ages 0 to 9, they only had a 5% positivity rate looking at all of their contents, versus in the age group 10 to 19, so this is middle schoolers and high schoolers, nearly 18% of those patients' contacts had seroconversion to positivity. Overall, they found that children in the elementary school were half as likely to transmit the virus than overall comers. So you can see the overall positivity rate for all contacts was nearly 12%, but contacts of young children was only 5%. So this is an important piece of data looking at the transmission piece, obviously in a country with really extensive contact tracing. So I think you can see the differences in the data from each separate country makes it a little bit difficult to compile the data sets together to get a complete picture. What I wanted to show you is in the United States, this was a very recent article that came out in the Journal of Pediatrics, and they didn't look at children and they didn't look at the community. What this author looked at was the rate of transmission in caregivers. So this study was out of Yale, and they looked at nearly 50,000 childcare workers. Now, this was in the very beginning of the pandemic, so in the very first 3 months. And they interviewed 57,000 childcare workers. About half of them continued to provide in-person childcare during the pandemic, during the first wave of the pandemic, while the other half stayed home. You can see this lady is by herself, no kids. And what they found between the 2 cohorts is they found no difference in infection rate between the 2 groups of adults. So the fact of being a caregiver in in-person childcare with adequate mitigation strategies in those schools, those teachers were not at any higher risk than teachers and caregivers who stayed home. Now, the interesting piece of this, I thought, if you drill down a little deeper in the data, is they separated out caregivers who were in kind of an institution or a school or a building that wasn't their home, and caregivers who provided childcare in their home. And in that subset of caregivers, they were slightly increased risk to have contracted the virus. And the authors postulate that that's because maybe in the home they weren't as careful about some of the mitigation strategies that you would be if you were in a brick and mortar school. Going further, so we talked internationally, then we talked about the US, and now we're just going to talk about Arizona. I find the Arizona Health Department website and the Pima County Health Department website really important in looking at all the current data. And I pulled these two data sets just yesterday. What I'm showing you here is what they call a congregate setting with confirmed COVID cases. So we would know this as, more colloquial as an outbreak. So when you have, and it just takes two people to have an outbreak, where they catch it from each other in a congregate setting, that's an outbreak. If you look at all of the congregate settings over Pima County, now this is from the very beginning of the pandemic, so this data is cumulative from March to currently. You see that in all of Pima County, there's only been 2 outbreaks in childcare, daycares, or schools. Now, this data may not be complete because many schools do not report. It is my understanding that Catalina Foothills School District does report to Pima County Health Department. But if you think about all of the hundreds of daycares and schools that have been open throughout the pandemic, that there have been only 2 reported outbreaks has been very reassuring. Looking at just the Catalina Foothills School District, there's been 423 cases that have been reported. Again, this is through the Pima County Health Department. This was pulled as of yesterday. And it's interesting because you click around, and the bigger your school district is, the more cases you have to present. I fooled around a little bit with this, comparing the school districts to the zip codes, and they match almost exactly. So I think what we're seeing here in Pima County is really a reflection of what you're seeing internationally, that the schools that have cases of coronavirus are not causing an outbreak, but they do rather reflect what's going on in the surrounding community. I want to talk about some notable failures that have been in the news that we can learn a lot from. One that comes up a lot in conversation, both in the hospital and outside of the hospital, was what happened at the YMCA camp this past summer. So in Georgia, at the end of June, they opened up a YMCA camp. It was a sleepaway camp for children. And prior to entering the camp, they had everybody undergo coronavirus testing. So this was PCR, nasal swab. It's supposed to be the absolute gold standard of testing. But still, within a week, nearly half of the campers, half of the attendees, including the counselors, tested positive. Why they think this was such a super spreader event is because masks were not enforced among the campers. Some of the staff were wearing masks, but not all. There was a lot of singing and a lot of cheering. I think you can see from this picture, this is what makes camp fun. There's 15 to 20 kids all crammed together in a bunk. Physical distancing is not a thing. What I think we can learn from this super spreader event is that, number one, being in close communities without masks, lots of singing, lots of cheering, sleeping together in a cabin, probably not safe. Number two, testing is not 100%. And when you amplify a very small percentage of false negatives by an entire camp, you get an outbreak. The second very publicized case of a high school outbreak was also in Georgia. I don't mean to pick on Georgia. It was just the two. It was 2 very demonstrative cases that I thought of. And you guys might recognize this picture. This photograph was posted on Twitter by a student at North Paulding High School. And she was upset because she felt unsafe at school because she felt like everybody was packed in and nobody had masks on. Within a week, there was at least 9 students who tested positive for the coronavirus, and the school was subsequently closed, and a mask mandate was then instituted. Interestingly, the student got a lot of heat for posting this picture. It's against their school's policy to post during school. So I guess she was suspended for a little while, and then they removed the suspension. So it created a lot of media interest. But I do think it's interesting that at the very peak of Georgia's first wave, they opened up high school. without a mask mandate. And unfortunately, they did see many cases. Since then, this high school has not seen many cases since they have started to wear masks. So that's really good news. Why don't kids seem to transmit the coronavirus like adults do? This is a really exciting slide. It's very dense, so let me go slowly. In the lower left-hand corner, you see this little emblem, and this is actually the coronavirus. This little lollipop on it, that's the spike. That's how the virus enters the cells. This is also how the human, oops, I went too far. This is also how the human immune system will recognize the virus. This globby drawing here is a 3D rendition of what the actual spike protein looks like. And all of these little spots in blue and red are the specific spots of the spike protein that the human immune system recognizes. So each of these little spots, your body can develop an antibody for. This article just came out last week in Science, and it's really exciting. What it shows is that many different coronaviruses have cross-reactivity, including many coronaviruses that cause the common cold. Now, these coronavirus antibodies don't last forever, but I mean, you guys are all parents. You know that, especially young kids, they have a snotty nose from November to April in usual times. They're catching coronaviruses continuously. And what this research shows is that in some patients, you will have cross-reactivity from the common cold to the novel coronavirus. This doesn't happen in everybody, but this is one of the theories why especially young children who have all of these new coronavirus antibodies are not seeing the transmission and the infectivity rate as adults are. You can see this pink on the bottom means cross-reactivity. And these are actually from volunteers who don't have any exposure to the novel coronavirus. So this is really exciting news to come out in support of a cross-reactivity theory. The other theory that students of a young age don't catch the coronavirus or transmit the coronavirus with as great a frequency is more like the dose response curve. So kids are small. They don't have a lot of air to breathe on other people, and they don't have a lot of virus particles in that air to breathe on other people. So, I tell my kids not to eat the poison red berries, but if they are going to eat the poison red berries, which they shouldn't, I'd much rather they eat one than a whole handful. One poison berry is probably going to give you a big stomach ache, but it's not going to kill you. Now, that happens also with the virus. So if you look at giving a few viral particles to mice, it has been shown that they don't get as sick as if you give a ton of viral particles to mice. In virology, they call that the inoculum. So large inoculi are associated with a higher mortality rate and a higher morbidity rate in mice. Even more interesting is a research project done in hamsters. And what they did is they separated hamsters with infected hamsters and susceptible hamsters, and they put a surgical mask between the cages. What they found is that the surgical mask decreases the number of susceptible hamsters to catch the virus. So masks help prevent infection. But what they also showed is that in those hamsters who still contracted the coronavirus, despite the mask, those hamsters got less sick than if the mask wasn't there. And again, the researchers postulate is because of the viral load and the viral inoculum that at least in mice and hamsters, now we're not mice and hamsters, but in the mice and hamsters, if you give them small amounts of the virus, they get less sick than if you get them big amounts of the virus. So it was a very, very elegant study done in not only showing that my mask protects you, but showing that your mask protects you. Talking about masks, there is a wonderful experiment that you guys can do at home with your kids. Masks are not all the same. The most important thing is mask versus no mask. But I encourage you to collect all the masks you have in your house at this point and a bunch of different kinds of fabric in your house to see if you can blow out a candle. So William, my son and I did this with a few different types of masks. So let's see. Hopefully you can still see this. I put some subliminal messages in the beginning of my presentation. Wear your mask. So the first thing we tried to do is blow out a candle without a mask. And you can see what happened. All right, easy peasy. Blow out the mask. And then I always see these ladies with the cute scarves across their face. So I brought out my cutest scarf.
Ooh,
but he
got it.
Yeah, he could still blow out the candle. So that cute scarf probably wouldn't keep me very safe.
Okay,
Finally, we
try
brought
to
out
blow
the
it with
real
your
deal.
mask on. Blow, harder, harder.
So as you can see, he really couldn't blow out that candle with his mask on. I hope you can also see our dino in the background has also donned a mask for this video. So in summary, masks are awesome. And there's lots of wonderful scientists out there that are really looking at the different types of transmission in schools. It's very difficult to decide which data is applicable, but more science to come. Thank you so much.
Dr. Baker, thank you. That was fantastic and succinct and understandable for those of us who are not scientists. I really appreciate how you prepared. I just also want to clarify or ask a clarifying question, and then we can open it up for a couple minutes of questions that others have. The Pima County Health Department data that you cited about the school districts, I'm assuming that means the geographic areas of those school districts. Is that your understanding?
My understanding was that the school district itself had given those numbers to the county.
Oh, interesting. Okay.
Total number of cases. Mm-hmm.
Total number of cases. Okay. All right. Well, thank you. What questions do other attendees have for Dr. Baker in the few minutes we have left? Feel free to pop in. And if you'd prefer to jot them in the chat box, you can do that as well. You were so thorough. There may not be any questions.
Or maybe their heads are just still spinning from that really scientific picture of spike protein.
Yes. Well, then I will also invite people to share any comments about the presentation. If you have any feedback, we're not going to send a formal feedback form, but we would be open to hearing your thoughts. And if you have topics of interest for future Fireside Chats, we would be open to hearing those. And other than that, we will let you go and get on with your evening. I know it's been a long day for everybody. So thank you so much for attending tonight.
Thank you so much.
Yeah.
Kim, I think there's some comments in the questions in the
Are
comments.
there? And I'm not seeing them. Oh, thank you. Okay.
Yep.
What does cross-reactivity mean?
Oh, thank you. So cross-reactivity means a specific antibody for one virus has some reaction to another virus. So let's say you get infected with virus A and your immune system makes a whole bunch of antibodies for virus A. If you get infected with virus B, some of your antibodies from virus A can attack virus B, even though your body has never seen virus B before. We call that cross-reactivity.
Thank you. And yes, Amanda, I will follow up on that 463 number. I don't see any other questions. And yes, this will be made available. We're recording the session and I will post it on Bloom's tomorrow.
Yes, we'll have to look at that number. Maybe I misunderstood that data.
That seems very high to me from my
maybe it's just the zip codes that
I
are
can tell you
reporting.
they're not students. That much I know, because that
Right.
number is a minuscule number district wide. So
Right.
but we will certainly get back to you on that. All right. Well, it is 5:59. Look at that. We wanted to provide you with something that was succinct and hopefully very useful. And feel free to email me any other feedback or topics of interest for you for future Fireside Chats, and we'll see you next time. Have a good evening, everyone. Thank you again, Dr. Baker.